So I want to talk to you today about sexually transmitted infections or STIs. The first thing that I want to be clear about is STI or STD are interchangeable terms. You may be more familiar with the acronym STD, which stands for sexually transmitted disease. However, the medical community came out and said that sexually transmitted infection is more medically accurate. Because disease does imply that there are chronic symptoms and that there is damage done. A lot of sexually transmitted infections have no symptoms, and they may take a while to develop into a disease with those chronic symptoms and damage done. And so you will hear me use the term STI or sexually transmitted infection because that is considered more medically accurate. But know that STD is the same thing. So if that's the term that's more familiar in your head, that is okay. So to start off, we first have to talk about how STIs spread from one person to the next, because your body can't just create an STI on its own. It has to be passed from person to person. That's a really important thing to note. And so the most common ways that STIs are passed from person to person is through, you guessed it, sexual contact. They're sexually transmitted infections, and so they're transmitted through sexual activity. There are two ways through sexual activity that they are transmitted from person to person. The first way is from an infected body fluid getting into a body opening. Now, when I'm saying infected body fluids, I'm referring to three specific body fluids, and those are semen, vaginal secretions, and blood. And when we're talking about body openings, we're talking about genital body openings. But also remember that we all have eyes, ears, mouth, and nose, and those are body openings as well. When we're talking about genital body openings, it's important to note that males have two genital body openings, your urethra and your anus. Females have those two as well, but females have a third genital body opening, which is the vaginal canal or the vaginal opening. And so if you get an infected body fluid like semen, vaginal secretion, or blood into one of those body openings, an STI can be passed from person to person in that way. The other way through sexual activity is through skin-to-skin contact. Now, I'm not talking about holding hands or high fives or brushing up against somebody when you're playing basketball together. Not that kind of skin-to-skin contact, but specifically genital skin-to-skin contact or contact with the genital skin. You guys are probably aware that throughout the day we shed skin cells. If you brush up against your hand, you're not going to be able to see them, but you lose skin cells through that process. And so your genital skin is the same way. If you have a type of sexually transmitted infection that's passed through skin-to-skin contact, then when that skin-to-skin contact occurs, those skin cells slough off and pass the infection to the next person. And so this is why we categorize the underwear zone as sexual activity, because you can contract an STI through that type of sexual contact. Now, there are three other less common ways and that aren't through sexual contact that STIs can be passed from person to person. The first one is through sharing needles. Now, typically, sharing needles would happen during illegal drug use. And because it's illegal, they do not have the equipment readily available to them, and so they will share needles. Now, what this does is when the needle is put into someone's skin, it creates a body opening. And then there can be microscopic blood left in the tip of that needle. And so that allows that infected body fluid into a body opening. And so it creates that infected body fluid to body opening transfer of an STI. So sharing needles would be the first way. Blood to blood contact is another less common way that STIs can be passed. So say you have a friend who gets injured and they're bleeding from their forehead, and you rush over and you put your hand over their bleeding wound, and maybe you have a hangnail or a paper cut of some sort on your hand, then their blood can come into contact with your blood and pass an STI that way. This is the reason that medical professionals, nurses, doctors, anyone in a hospital wears gloves on their hand when treating a patient. These are called universal precautions because you can't just look at a person and tell if their body fluids are infected. And so they go ahead and place that barrier between themselves and anyone else for that level of protection from blood to blood contact. The third and final one that is very uncommon in North America especially is mother to baby. So there are some STIs that can be passed from mom to baby during childbirth or during breastfeeding. Now, because of our medical advancements and because of STI screening while a mother is pregnant, this is a very low chance of contraction for babies and mothers in North America. Most of the time, doctors are aware if mom has an STI, and so they're going to take the precautions, whether it be to treat that STI or to deliver that baby via cesarean section instead of vaginally to prevent that type of transmission. But it is important to know that that is a possibility from mom to baby. Now that you know how STIs are transmitted from person to person, there's another thing that it's very important to understand. STIs fall into basically two main categories. You have your bacterial infections and your viral infections. Now, there's a difference between those two, and the main difference is how or if they can be treated. Now, I'm sure a lot of you have had maybe strep throat or a sinus infection or an ear infection at some point in your life. If you have, you know that when you go to the doctor, they will give you an antibiotic. You can take that antibiotic and you start feeling better pretty quickly, usually within a few days, actually. And so the reason for that is because those types of infections are caused by a bacteria, or they're bacterial infections. They can be killed and treated by an antibiotic. The other category, viral infections, those are things like your flu or your cold or most currently the coronavirus. And so those types of infections, they don't have a treatment like an antibiotic. Doctors will typically say something to you like, well, it just has to run its course. They may be able to treat the symptoms like fever or a runny nose or a cough with medications, but there's no way to actually kill those viral infections. They just have to run their course. STIs fall in these two main categories as well. You have bacterial STIs and you have viral STIs. For bacterial STIs, you're able to take an antibiotic either orally or through an injection to clear up that bacterial infection. On the flip side of that, viral STIs do not have a cure, and running their course is your entire life. So if you are to contract a viral STI, that is something that you would have for life, unfortunately. The doctors are able to treat the symptoms with medication, but they cannot cure that virus, much like they can't with the cold or the flu. So it's very important to understand that distinction between the two categories. Now let's talk about some of the most common STIs in those areas and some of the signs and symptoms and things that are important to know. Under our bacterial infection category, I want to talk to you first about chlamydia. Now, a lot of you have probably heard the term chlamydia before. This is a bacterial infection. It's known as the silent STI. The reason for that is because it doesn't have any symptoms. Sometimes it will have symptoms in males, but they are very faint symptoms, like maybe some slight burning during urination. And so for that reason, chlamydia oftentimes goes untreated and passed from person to person. Even though an antibiotic clears it up very quickly, it does go untreated very often because there are no signs or symptoms. If left untreated, chlamydia for females can actually lead to pelvic inflammatory disease, which is an infection of the pelvic area, the uterus, the ovaries, the fallopian tubes, and can actually lead to sterilization. So while it is a very treatable STI, it can be very dangerous if left untreated. And so it's very important for those who are sexually active to be getting screened regularly for STIs. Typically, medical professionals recommend that you are screened yearly or with every new sexual partner, so that you are making sure that you're not passing an STI without symptoms from person to person, that you're getting treated as soon as you find out about that. The next one I want to talk to you about is gonorrhea. Gonorrhea is known sometimes as like the big brother to chlamydia. And so it does have signs and symptoms. Typically, there will be some painful urination, pain during sexual intercourse, and even a thick greenish discharge, often from males, that will come from the urethra. So gonorrhea is a bacterial infection as well. It is treatable by antibiotics. However, it is important to note that around 5 years ago, there were 5 antibiotic treatments for gonorrhea. There is now currently only one. It is becoming antibiotic resistant, meaning that it is able to change itself so that certain antibiotics do not work in killing it. It's a very smart bacterial infection. And so because it's been passed from person to person so often, the antibiotics that typically doctors would use are becoming useless against it. And so we're down to one. Now they're currently in trials and seeking out other treatments, but that could become a bacterial infection that is untreatable at some point. The problem with gonorrhea is that thick greenish discharge can actually clog the urethra, making you unable to urinate. Now, if you don't know this, it's very important that you pee. If you can't pee, you can't live. That can actually cause death. And so it's very important that gonorrhea be treated and not get to that point. The last bacterial infection that I would like to talk to you about is syphilis. Syphilis, or often known as the SIF, is a bacterial infection that can lead to lots of different symptoms, and it actually has stages. So in beginning stages, it can lead to things like fatigue, maybe a low-grade fever, some symptoms that oftentimes people will overlook or brush off as maybe I've just got a little cold or some type of, infection, a bug, I'll fight through this. Those symptoms will actually go away without any treatment. That doesn't mean that syphilis went away, though. The bacteria is still in your body. The next stage will often lead to different rashes or sores. These are painless sores. They don't cause any pain at all. And so those sores may appear on the genital area in places where you wouldn't often see them. And these sores would also go away on their own. These rashes would go away on their own. And so oftentimes if someone is not getting regularly tested, they would just kind of ignore that as maybe just a weird symptom. However, if left untreated, syphilis in its very late stages can lead to what are known as gumas, which are flesh-eating sores that actually eat away at organ tissue, so internal damage. So there have been cases of patients who have died from what appears to be heart failure. And when they opened that person up for an autopsy, they found that there were gumas eating away at the heart tissue that actually led to their death. And it was an untreated form of syphilis. Those gumas can actually eat away at brain tissue, leading to insanity. So if you've ever heard someone say, if you get syphilis, you'll go crazy, that is the reason that is said about syphilis, because it can actually eat away at brain tissue. So it's very important, especially for bacterial infections, to be getting tested regularly if you are someone who chooses to be sexually active outside of that committed married relationship. Of course, once you're in a committed married relationship and both of you know that you are not carrying any STIs, that's not something that you would have to worry about, because remember, they have to be passed from person to person. Let's move on to viral STIs. Now remember, viruses can't be cured. We can treat the symptoms of a virus, but these can't be cured, and running their course is your entire life cycle. The first one that you're probably most familiar with is HIV, or the human immunodeficiency virus. Now HIV is a virus that later on can lead to AIDS, or acquired immunodeficiency syndrome. It's important to know, though, that someone with HIV does not always have AIDS. AIDS is actually referring to a condition where their immune system gets so suppressed and HIV levels are so high that they would be diagnosed with AIDS. Now, HIV back in the 80s was a sure death sentence. They did not know a lot about it, and they were very incapable of treating the symptoms of HIV, and it almost always went into full-blown AIDS, and that person could die from something as simple as the common cold or the flu because their immune system was so suppressed and damaged. However, now, because of antiretroviral medications, HIV is able to be treated, the symptoms are able to be treated, and most people are able to go with just having HIV and not going into full-blown AIDS. So while you would have to have HIV for your entire life, that is something that you would have to discuss with future sexual partners if you were to get married, because HIV is passed through body fluids. It's one of those that's passed from person to person through infected body fluid getting into a body opening or that blood to blood contact. That is something that you would manage for the rest of your life, explaining to those around you that you are HIV positive and trying to prevent exposing others from that specific virus. The next one is another one that you may be familiar with because it's on TV a lot, and it's HPV, or human papilloma virus. Now, this virus has hundreds of thousands of strains of HPV. Now, some strains of HPV are not sexually transmitted. That's important to understand. Those strains of HPV lead to regular warts on your fingers, on your feet, wherever you've had a skin type wart before. Those are the strains of human papillomavirus that are not sexually transmitted. However, there are around 60 that are transmitted through sexual contact. Now, these can be transmitted through infected body fluids into a body opening, but they can also be transmitted through that skin to skin contact as well in the genital area. HPV does lead to genital warts. So those are the warts that you would have on your hands or feet, those types of warts, but in the genital area. They are removed, unfortunately, the same way they would be off of your hands or feet. They're frozen or burned off of the genitals, and they would continue to come back most likely. So that is something that you would battle for the rest of your life with HPV that leads to genital warts. However, there are some strains, and these are the ones you've probably seen commercials for, that lead to certain types of cancer. A lot of them are linked to cervical cancer in females, and more recently they have been linked to throat cancer. And so this could be happening through oral sex, where you have that skin to skin contact, and also infected body fluids going into that body opening as well. And so there are HPV vaccines that can decrease the possibility of being exposed to HPV that is linked to cervical cancer, but that is not a 100% guarantee that you would not contract that virus. So it's important to understand that nothing is going to protect you 100% from that, except for abstinence. Remember that staying abstinent or not being sexually active until you're in a committed married relationship is the only way to 100% guarantee yourself that you would not contract an STI. The last one I want to talk to you about is herpes. Herpes, a lot of people talk about this. And so herpes has two separate viruses. There's the herpes simplex virus type 1, which leads to cold sores. Some of you may even get cold sores on your mouth if you have a cold, if you've had a fever, or maybe if you get really stressed out. That is not a sexually transmitted infection. It's very important to understand that is not how that is transmitted. However, the herpes simplex virus type 2 is sexually transmitted. It is sexually transmitted through infected body fluids into a body opening or skin to skin contact. It's also important to note herpes causes sores, blister-like sores, much like a cold sore, in the genital area. Those sores will bust and break open and can cause that virus to spread through those infected fluids. But it can also be passed from person to person before those sores are actually visible to the person. There's no actual test for herpes unless you request it. It's not a standard STI test that you would be given, so you have to ask for that one because doctors figure once you have symptoms, they'll just treat the symptoms. So even if someone is getting tested regularly, it's possible that they have herpes and haven't had their first outbreak. And so being aware of that is very important. Herpes is something that you would have to treat the symptoms for the rest of your life because it is not curable. It is a viral infection. And so those sores that develop are very painful, itchy, they burn, and they can be very uncomfortable for the person. Now, oftentimes students will say, well, what about condoms? Don't condoms protect you from the STIs? Or they'll say, well, what about safe sex? It's a big pet peeve of mine because safe means that there's no risk at all, that you've eliminated the risk. Unfortunately, condoms do reduce the risk of STIs because they are a latex covering typically worn on the male's penis. They will keep that body fluid of semen from getting into a body opening, and they'll even protect the male's penis from having vaginal secretions get into that body opening, the urethra there. But they are not 100%. They're not worn over the entire body, and so they do not reduce the risk of skin-to-skin contact in the genital area. And condoms can break and tear, allowing body fluids to get past. And so while they do reduce the risk, and it is important for those who choose to be sexually active to use a condom with each and every encounter of sexual activity, they are not a 100% guarantee that you will not become infected with a sexually transmitted infection. So it's very important to understand the differences between bacterial infections and viral infections and how these infections are transmitted from person to person. Going back to the bacterial infections, gonorrhea, chlamydia, and syphilis that we discussed, those are passed through body fluids into a body opening. So most oftentimes that skin-to-skin contact is with viral infections. That is why we really want to advise you about the underwear zone being sexual activity, because that does put you at risk of sexually transmitted infections, and most people aren't thinking about reducing the risk when they're engaging in that type of sexual activity. So I hope you guys learned something about STIs today, and we'll talk more about this later.